and show this. Hi guys, it's Danielle, Dr. Emer's office. I'm borrowing this from our patient. She was just browsing through our Jeuveau brochure. So we love this here. We love the brochure. We love the pink. I am loving these pink gloves. I cannot wait to get more of them. But Jeuveau is the newest neuromodulator on the market. So it's very similar to the botox and Dysport that we know and love. It is, from a clinical standpoint, the same molecule size as Botox, so you're going to inject it the same way. So from a patient standpoint, you should know that you're going to get consistency with your treatments. It's not going to be something very new. It's, from a provider and a patient standpoint, a good transition of comfort. So I always recommend that people try the new products, try Botox, try Dysport, try Xeomin, try Jeuveau. So now that we have another one on the market, it's the newest, latest, and greatest, so we're really excited.
I'm excited.
And for our patient here, it's time to reduce the fine lines and wrinkles. So what we're going to do is a little bit of Botox all over. So forehead, glabella, crow's feet, get a little bit of brow lift, nothing too crazy. But what's great about combining all these areas is that you get the kind of full area to soften and enhance the overall image, but everything looks very balanced. So you're not going to have no lines in one area and then lines in another. Depending on what the patient wants, we can do that. But for her, she's going to have some opening of the eyes, and that'll be really great. So with that, we've already cleaned the skin. We're going to go ahead and start in the glabella. So we're looking for a little bit of brow lift. So we'll do an extra little poke at the lateral brow. And then we want just softening of the movement, but nothing completely frozen. So I'm going to have you center your head and then just go ahead and frown for me. Hold that. So we can see between the procedural and the corrugators, her muscles are very strong here. So relax and then frown one more time. Frown. You can see how these muscles really just pop right out. Go ahead and relax. So with that, we can use Jeuveau to really get some softening. So I'm going to pinch right in the middle, a little poke, okay? First one. Good. We're going to get a lot of softening in about a week. She's going to see that everything is relaxing. She's going to be much more refreshed looking. A nice little relaxer. It's like getting a staycation from us.
I might be able to yell without looking crazy.
Frown for me one more time. Frown right in here, squeeze, good, and relax. I always was joking with patients that their kids are the first people to notice. They're like, Mom, you sound angry, but you don't look angry. And kids are very observant, but this is something that's really going to make her feel like she's taking action towards anti-aging. So this is preventative neurotoxin use. And so what that's going to do is keep her ahead of the game when it comes to not developing lines and wrinkles. Another poke right the side of the brow. Good.
Easy breezy.
Easy breezy. So again, our newtox here, hashtag newtox that we love, is going to be injected the same way. So my units are unit per unit, so that's great for a patient because they kind of know what works for them, and as an injector, there's a lot of ease with that. Go ahead and raise your eyebrows all the way up. Really, really, really strong, good, and relax. Perfect. So I like to do kind of micro Botox throughout the forehead. Keep it really soft, but soften the lines. Raise your brows up again and relax. It's always important to consider going up close to the hairline because we do get those lines up there and you don't want some moving and some not. Eyebrows up one more time and relax. Eyebrows up and relax. Great. So I know that our patient hasn't had Botox done super regularly because patients who do, they can kind of tell you what it feels like to have one injected versus another. But the consensus so far from a patient standpoint has been that this feels very comfortable with injection. Does it burn, sting, or anything at all?
No, it's like a very little pinch.
Okay.
Yeah.
Great.
Yeah.
So now we're going to move over to the crow's feet. So again, this is something that when you combine the crow's feet tox with Glabellar, what you're getting is opening of the eyes. So this is great for anyone who feels like they just are getting a lot of crepiness around the eyes, or if they want some opening, as well as for people who are starting to develop a little bit of hooding on the lids. this gives you some lift here, which is very nice feeling. It's a great refresher. So smile really big for me. Good, and relax. Perfect. Guys, are there any questions on Jeuveau so far?
A general question of how long do these bumps last? What are they?
Okay, so these bumps are just because we're putting fluid underneath the surface, and they're really just gonna last about 15-20 minutes tops. I'm gonna do one more little poke right in here to help with some fine lines. Good.
Does Jeuveau last longer than Botox?
We're gonna find out. It's been so okay.
To be determined.
To be determined. So based on the studies, actually, the satisfaction rates were similar. The longevity was very good with this. The satisfaction at the 12-week mark was great. So that is a good thing. I do think that how long something lasts is very, very individual based. So we'll have to see. And again, this one little poke here for the crepiness. Great. We'll have to see how it does. But when they did the head-to-head studies and they did the direct head-to-head studies, the satisfaction rate for Jeuveau is coming up just a little bit higher. So I do urge all of my patients to give it a try and see, because you're going to formulate an opinion on it. It's definitely worth trying. It's been very comfortable for injection, so we love that. And it's new, and we love new in the cosmetic industry. So any questions, you guys, let me know. Is there anything so far?
Well, what is being injected?
So this is Jeuveau. I'm going to show it to you guys. We have this right here. So we're coming in strong with the pink. It's the breakthrough new treatment that is a neuromodulator to relax movement lines. So it is a direct comparison to the Botox molecule that's out there. So it's going to give you the same sort of result that you've been getting with Botox, except it's brand new. And it's been really great so far. Patient satisfaction is very high. This is our brochure. If you have more questions about it, please come in and see us. But this is where you can get some new information on the latest and greatest. And again, if you have questions, just let me know. You did great. How was it overall? Not too bad, huh?
Super easy.
Really easy. So she'll see this kick in about a week. And at that point, you're going to notice over time that your muscles between the next few days, they start to soften and soften until our end result has fully kicked in. So we'll see how she looks in about a week, and we'll get her feedback on it. Thanks everyone for watching. Send in any questions you have. Bye.